I'm going to discuss the results of the EPIC study, which is a fairly early readout that we presented in this conference. The EPIC study is an initiative that we've been doing in collaboration with AstraZeneca. We're looking into a very captive population that was treated in the UK with the compassionate use program of Acalabrutinib on patients that were untreated CLL, and the program just went on until Acalabrutinib got approved and reimbursed, and then retrospectively we are recollecting the data that, of these patients that equates to probably nearly 400 patients, and we're just in the process of collecting. So the abstract you will see is just a minority of these patients, which essentially just demonstrate what we knew about BTK inhibitors in terms of efficacy, with a PFS that is above 80% in the first 2 years, and with a side effect profile that just basically mirrors what has been observed in clinical studies in terms of major infections and bleeding and atrial fibrillation. So in essence, the trial does not bring any significantly or new exciting data, but it's very important to have that data in this patient population, because currently in the UK, Acalabrutinib is not licensed for use in frontline in younger patients. It's only licensed for the older patients, and we would hope that we would get some very interesting information in the long-term follow-up of these patients in order to give the regulatory agencies some significant data that would help to perhaps reconsider the reimbursement of Acalabrutinib in the future. So we're in the process of collecting the data, and the main important point of the study is that it's not going to be just a longitudinal collection of data just now, but we will be following those patients prospectively after they have been collected now, and looking at the outcomes of not only the CLL itself, but also the outcome of subsequent treatments, which I think will also bring some very interesting information for the CLL community. So this is just the very first beginning of a project that is going to take a few years, and we hope to be bringing more results and more complete data about these patients in the next few meetings.